Very good afternoon to all. I am really glad to be back on this platform of BabyChakra. Today, our topic is basically about how to look after your hair and skin during pregnancy and after pregnancy. अक्सर ये होता है कि जब हम प्रेग्नेंट हो जाते हैं या फिर प्रेगनेंसी के बाद काफ़ी सारी महिलाओं को काफ़ी सवाल होते हैं कि स्किन में चेंजेस आते हैं, हेयर में चेंजेस आते हैं, तो इसका हम क्या कर सकते हैं। इसमें बहुत सारे क्वेश्चंस होते हैं जो एक वुमेन को, एक महिला को काफ़ी स्ट्रेस आउट भी करता है, क्योंकि इस दौरान जब आप प्रेग्नेंट होते हो काफ़ी सारे हार्मोनल चेंजेस आते हैं जिसकी वजह से आपके स्किन में और हेयर में वो चेंजेस दिखने लगते हैं। तो जब बहुत सारे पेशेंट्स मेरे पास आते हैं और मुझे पूछते हैं कि डॉक्टर हमें क्या करना चाहिए, because the primary concern what every female has during this time is the changes what she goes not only emotionally but also physically. It actually revolves around her, and due to which she gets stressed out. It adds to her stress, it adds to her emotional dealings also. So today, considering these number of questions what we have from so many patients, let's concentrate on what can be done, what not to be done during pregnancy and after delivery. तो आज आई एम वेरी श्योर कि बहुत सारे पेशेंट्स हैं, बहुत सारे महिला हैं जिनको बहुत सारे सवालों के जवाब चाहिए। बेसिकली एक ब्रीफ में बताती हूँ कि क्या होता है ड्यूरिंग प्रेगनेंसी। प्रेगनेंसी के टाइम पे हार्मोन्स काफ़ी चेंज हो जाते हैं, ईस्ट्रोजन लेवल्स, प्रोजेस्टेरोन लेवल्स ये काफ़ी हाई और फ्लक्चुएट होने लगते हैं, जिस कारण आप देखोगे कि कभी कभी आपकी स्किन जो है वो काफ़ी अच्छी दिखने लगती है और किसी किसी लोगों में वो काफ़ी ड्राई होती है। तो ड्राइनेस बोलिए या फिर प्रेगनेंसी ग्लो बोलिए, ये दोनों चीज़ें जो है वो बेसिकली हार्मोन्स की वजह से होने लगती है। अगर आपकी स्किन ग्लो करती है, यू आर वन ऑफ द लकीस्ट पीपल टू बी एक्चुअली। और अगर ग्लो नहीं करती है और अगर आप देखते हो कि ड्राइनेस हो रहा है या फिर ऑयलीनेस हो रही है, तो डोंट वरी, वो चीज़ें भी हम कंट्रोल में कर सकते हैं। द मोस्ट इम्पॉर्टेंट थिंग इज़ कि कुछ चीज़ें आपको डेली रूटीन में यूज़ करनी चाहिए जस्ट व्हेन यू अंडरस्टैंड दैट यू आर एक्सपेक्टिंग योर चाइल्ड। द फर्स्ट थिंग इज़ बेसिकली विच कम्स फ्रॉम इनसाइड। सबसे इम्पॉर्टेंट चीज़ होती है एडिक्वेट अमाउंट ऑफ वाटर इनटेक। आपका पानी जो होता है, आपका पानी का जो इनटेक होता है वो आपको बढ़ाना चाहिए। यू शुड एटलीस्ट हैव 2 लीटर्स ऑफ वाटर पर डे। इससे क्या होता है कि जो आपका वेट और आपकी बेबी का वेट जो है वो मेंटेन रहता है। टॉक्सिन्स जो है वो टॉक्सिन्स भी चले जाते हैं बॉडी से, फ्लश आउट हो जाते हैं। हैव गुड अमाउंट ऑफ वेजिटेबल्स, मिनरल्स, विटामिन्स, गुड अमाउंट ऑफ प्रोटीन्स। कि किस किस लोगों को पानी का इंटेक पसंद नहीं आता है, प्रॉब्लम डोंट लाइक द टेस्ट ऑफ वाटर। In this case, what you can do is you can add a bit of flavors to the water. Along with water, have more of coconut water also. इससे भी हाइड्रेशन लेवल्स अच्छे होते हैं, ड्राइनेस की जो कंप्लेन है वो कम होती है। मॉइस्चराइज योर स्किन डेली। मॉइस्चराइज, अगर आप वाटर बेस्ड मॉइस्चराइजर्स यूज़ करें सो इट इज़ गुड फॉर योर स्किन। उससे स्किन ग्लो करती है, हाइड्रेटेड रहती है। स्ट्रेच मार्क्स जो एक बहुत कॉमन चीज़ होती है प्रेगनेंसी के दौरान, जब आपके कोलाजन फाइबर्स जो होते हैं वो स्ट्रेच होते हैं बिकॉज दी बेली स्ट्रेचिंग। आप जो देखते हैं जो स्ट्रेच मार्क्स होते हैं वो आपके ब्रेस्ट पे होते हैं, स्टमक पे होते हैं, आर्म्स पे, थाइस पे। तो इसके लिए आप स्टार्टिंग से ही काफ़ी सारे विटामिन ई एनरिच्ड ऑयल यूज़ कर सकते हैं, क्रीम्स यूज़ कर सकते हैं। इससे जो है वो प्रिवेंट होगा और ज़्यादा तकलीफ नहीं होगी आपको स्ट्रेच मार्क्स की। स्किन जब ड्राई होने लगती है तो आप उसको एक्सफोलिएट कर सकते हैं एक्सफोलिएटर्स के साथ। ये सारी जो बेसिक चीज़ है वो आप यूज़ कर सकते हैं। और एक चीज़ जो काफ़ी सारी प्रेग्नेंट लेडीज़ आती है पिगमेंटेशन के साथ। पिगमेंटेशन जो है वो बेसिकली होता है बिकॉज ऑफ हाई हार्मोनल लेवल्स। हार्मोन्स जब फ्लक्चुएट होते हैं या फिर आगे पीछे होते हैं तो उसकी वजह से जो पिगमेंट प्रोड्यूसिंग सेल्स होते हैं, मेलानोसाइट्स, वो बढ़ना शुरू होता है। और अगर वो बढ़ता है तो आप देखोगे एक टिपिकल पिगमेंटेशन आपको दिखता है। मोस्टली इट इज़ अ बटरफ्लाई पिगमेंटेशन जो आपको प्रेग्नेंट वुमेन में दिखता है कॉमनली। उसको हम अवॉइड कर सकते हैं, कम कर सकते हैं। द बेस्ट वे टू रिड्यूस इज बेसिकली यूजिंग अ गुड सनस्क्रीन ड्यूरिंग योर प्रेगनेंसी। If you use a good sunscreen, it will definitely help you in reducing the pigmentation to a very good extent. So here now we have a number of questions जो हमारे patients और हमारे viewers लेके आए हैं. Let's see what questions they have. तो यहाँ पे जैसे पूछा गया है कि शिवम करार पूछ रहे हैं कि मेरे पेट में निशान हो गए हैं, कैसे ठीक होंगे। जैसे मैंने बोला कि स्ट्रेच मार्क्स आर वन ऑफ the prominent signs that you have and symptoms that you come across during pregnancy. स्ट्रेच मार्क्स जो है एक वेरी नेचुरल प्रोसेस है बिकॉज ऑफ स्किन स्ट्रेचिंग, जिसको आप डील कर सकते हैं यूजिंग अ नंबर ऑफ ऑयल्स विच आर एनरिच्ड विद विटामिन ई. विटामिन ई से क्या होता है, जो स्ट्रेच मार्क्स है या फिर जो ड्राइनेस है वो काफ़ी कंट्रोल में आता है. सो राइट फ्रॉम डे वन यू हैव टू स्टार्ट यूजिंग दीज ऑयल्स. आप उससे हल्के से मसाज कर सकते हैं. ऑल्सो यूज सर्टन एक्सफोलिएटर्स जिससे जो डेड स्किन है वो भी निकल जाएगी. फर्मिंग होगा, अगर बॉडी फर्म होती है, बेली फर्म होती है तो स्ट्रेच मार्क्स भी बहुत हद तक लाइट रहते हैं. इचिंग के लिए आप मॉइस्चराइजर्स यूज कर. काफ़ी बार जो स्ट्रेच मार्क्स होते हैं वो बहुत इची होते हैं जिसकी वजह से आप स्क्रैच करते हो और उससे निशान जो है वो काफ़ी एविडेंट हो जाते हैं. सो यू कैन यूज गुड अमाउंट ऑफ मॉइस्चराइजर टू रिलीव दोज स्ट्रेच मार्क्स एंड इचिंग दैट इज कॉज्ड बाय द स्ट्रेच मार्क्स. अनदर प्राइमरी थिंग जो मैं बोलूँगी आपको है कि आप आपका वाटर इनटेक बढ़ाइए. इट इज़ अ वेरी नेचुरल वे ऑफ रिड्यूसिंग और प्रिवेंटिंग फर्दर स्ट्रेच मार्क्स. माधवी पूछ रही है कि वाई माई हेयर फॉल्स टू मच ड्यूरिंग वॉशिंग इट. ड्यूरिंग प्रेगनेंसी एज आई सेड, मोस्ट ऑफ द वुमेन देखेंगे तो उनका जो हेयर ग्रोथ है वो इम्प्रूव होता है. द रीजन वाई हेयर ग्रोथ इम्प्रूव्स इज बेसिकली बिकॉज ड्यूरिंग प्रेगनेंसी जो ग्रोथ फेज है आपके बालों का वो ज़्यादा बढ़ता है. उस दौरान आप देखोगे कि बहुत सारी जो औरतें हैं, जो महिलाएं हैं, वो बोलती हैं कि मेरे बाल जो है बहुत काफ़ी बढ़ गए या फिर थिक हो गए. बट कुछ पॉपुलेशन ऐसा भी होता है जो देखेंगे तो उनका हेयर फॉल ज़्यादा बढ़ता है या फिर उनको हेयर थिनिंग का प्रॉब्लम होता है. द रीज़न वाई यू एक्सपीरियंसेस इज बिकॉज आपका जो हार्मोनल लेवल्स है वो चेंज होता है. डाइट जो है वो कहीं पे आपका हैम्पर होता है. सो इट इज़ वेरी इंपॉर्टेंट कि अगर आप डाइट कंट्रोल में रखोगे या फिर आप हेल्दी और राइट डाइट लोगे विद गुड अमाउंट ऑफ वाटर इनटेक, you will not see that much of hair fall. Along with that, when you're pregnant, it is important that you start with certain supplements. These supplements will actually help you in improving your hair quality and hair texture. At times, the scalp becomes a bit sensitive. उसकी वजह से भी hair fall शुरू होता है. So you can actually ask your gynac or your dermat to suggest a few good shampoos and conditioners, a good oils which will help you in improving the blood circulation. कुछ अगर आप मसाज करोगे with a good amount of oil in your hair, even that improves blood circulation. So along with these few things अगर आप कंट्रोल में रखते हो तो you will see कि आपका जो हेयर फॉल का कंप्लेंट है वो काफ़ी कंट्रोल में आएगा. Revati is asking me how to control hair fall post pregnancy. Post pregnancy, for a period of 3 to 6 months, you will see that that is a time when the hormones start going back to its normal phase. तो जो चेंजेस आपने प्रेगनेंसी के टाइम पे देखे हैं वो प्रेगनेंसी के चेंजेस धीरे धीरे करके बैक टू नॉर्मल आते हैं. तो आफ्टर बर्थ 3 to 6 months is a time when you will actually see that the hair fall is too much. So during this phase, many women actually go through a lot of hair fall and some go through average bit of hair fall. The one thing what I would suggest during this time is you don't have to really worry about it. It is a very natural thing to happen, and after 6 months, you will see that the hair fall will stop on its own. But during this, what you can do is there are certain things what you can start. First, do not panic, do not worry. It's a very normal thing. Second, improve your water intake. Third, have good amount of green leafy vegetables, good amount of iron, folic acid, have good amount of fruits. Hydrate yourself. Third thing would be again considering good amount or good products which you can use for your hair. Use good amount of hair oil in case you feel your hair is too dry. Hair oil will boost this blood circulation, which will somewhere help in reducing the amount of hair fall that you're going through. Third, there are also many supplements that you can use. Sometimes your body is deprived of certain elements, certain vitamins and minerals. Because of such deprivation, you notice more hair fall during after delivery. So in that case, have good amount of multivitamins, have good amount of supplements, increase the protein intake in your diet. When you add all these things into your diet and into your daily routine, you will definitely see that the post pregnancy hair fall will be much under control. Bhavna wants to know that how can she get a glowing skin after pregnancy? A glowing skin after pregnancy, you can also have a glowing skin during pregnancy and after pregnancy both. What you can do is basically certain diet regimens or certain meal protocols need to be followed. The first thing what I suggest when a patient comes to me is you have to have good amount of water. Your hydration levels should be good. At least you have to eliminate the toxins from your body. If your toxins are eliminated from your body, automatically you will see your skin starts glowing. Second thing I will say is moisturize your skin daily. Cleanse your skin 2 times in a day with a good mild cleanser. Exfoliate it. Use a good moisturizer for your skin so that your skin does not become dry. If your skin is too oily, you do not really need to use a moisturizer. You can use a water-based gentle moisturizer. Along with this, you should have a good amount of proteins in your diet, have good amount of nuts, green leafy vegetables, fruits, vitamin C. You can use vitamin C tablets which are readily available in the market, or you can add a very natural source of vitamin C. Natural source of vitamin C are all citrus fruits, orange, lime, sweet lime, strawberries, berries, again green leafy vegetables. You can use substances of food that is rich in vitamin C. This again gives you a good glow. Have good amount of sleep. Sleeping for 8 to 10 hours will actually help you in giving a good glow. It also helps in reducing dark circles, which often you come under during pregnancy. This is very important. Try light exercises, try to meditate, do some yoga. If you're internally happy, you will see that it is shown in your face. So, internally, if you're doing right things, the right things are shown in your face as well. So, you can do certain these small list of things which will help you in having a good glow during pregnancy. There are certain creams which you can use, creams like a bit of glycolic based creams which will help you in good, which does help you in giving a good glow. Avoid creams which have retinoids or which have harsh chemicals. Use a good amount of sunscreen. At times, pigmentation really hampers your glow. So, if you want to control your pigmentation, it's very important that you start using good amount of sunscreen during your pregnancy. It's not only during pregnancy or after pregnancy, but it is something what you have to be using every day, every time. So, good amount of sunscreen, natural or mineral-based sunscreens you can use, because try avoiding sunscreens which are with heavy chemicals. So yes, if you do all these things, you will definitely see a good glow on your face. Madhvi is again asking me which foods are good for reducing hair fall. Not just food, but even there are certain supplements which you should start using during pregnancy, because at times the amount of food that you take or the food you consume is not really enough for you and your child. And during this time, you see that the food actually replenishes or it goes to the more important organs. So during this phase, you will see that your hair and skin sometimes get more neglected. So adding more supplements to your diet, adding protein supplements would also help you in having a good skin and good hair. Certain foods that you can use to reduce hair fall is definitely good amount of proteins. In proteins, you can have good amount of egg, the egg proteins, the white of an egg. Fish is very good with omega oils also. Omega oil helps you in reducing the hair fall and also helps you in having a good lustrous hair. So food which has good amount of omega-3, as I said, fish, have more of poultry like chicken, white of an egg, green leafy vegetables, pulses, nuts, fruits, citrus fruits you can have. Citrus fruits like orange, sweet lime, lemon. You can have kiwi also. Kiwi is a good source. Also, you can have strawberries, other berries. If you have all these food items, you will see that your hair fall reduces to a very good extent. amount of water. Along with water, you can also have, you can say, coconut water as well. So this will replenish the amount of vitamins or minerals that are getting lost, and thus it not only improves your hair fall, but it will also improve your skin tone as well. What can be done for pimple free skin naturally? The best way to avoid pimples, पिंपल्स जो है बहुत सारी प्रेग्नेंट औरतें कंप्लेन लेके आती है कि उनकी जो पिंपल्स है या फिर जो एक्ने है वो प्रेगनेंसी के टाइम पे डबल ट्रिपल हो जाते हैं. ये तब होता है जब आपकी स्किन बहुत ऑयली है और प्रेगनेंसी के टाइम पे बिकॉज ऑफ हार्मोनल चेंजेस यू सी इट बिकम्स मोर ऑयली and you come up with a burst and outburst of acne. इस टाइम द बेसिक इम्पॉर्टेंट चीज़ जो आप कर सकते हो, जैसे आपने मुझे पूछा है कि नेचुरली आप क्या कर सकते हो, नेचुरली वाटर इनटेक बढ़ाइए, increase the amount of water, have at least 10 to 12 glasses of water. This is the first and primary thing what you can do. Second thing is you can have good amount of fruits. Fruits again help you with the water intake. जो water content है fruits का वो आपको एक natural skin glow देता है and it helps in combating the bacteria which are producing your acne या फिर जो excess oil produce हो रहा है आपके glands में वो control में आता है. तीसरा, आप अच्छा डाइट लें, डाइट विच इज रिच इन iron. That also improves your acne. Fourth, I would say there are many creams that you can use. Creams which have good amount of glycolic content. Glycolic content जो होता है वो to a very good extent will actually help you in reducing the acne. At home, you can use tea tree oil also. You can dilute tea tree oil in water and you can apply it on the spots where you're getting acne. The other thing what you can do is you can also use apple cider vinegar, dilute it in water, and use it on the areas where you have acne. So these are the free, simple home remedies what you can do to actually reduce your acne or to get your acne in control. Sonam Patel is asking ki how long does the postpartum dry skin last? Postpartum dry skin usually will last for a period to 3 months to a year. As I said, your body is undergoing a lot of changes after delivery. It is a time when the body goes back to its physiological state again. जो changes आए हैं वो वापस back to normalcy में जाने लगते हैं. So during 3 to 6, 12 months, you see that the dryness or the hair fall stretch marks, they take 3 to 12 months of time to see the dryness going. During this time, I would suggest that if you want to see a good early changes, use good amount of moisturizers, use good amount of exfoliators to take away the dry skin or the shedded skin. Moisturizers will help you in keeping your skin soft and supple. It also helps in preventing further dryness. When your skin becomes too dry, you see that you start scratching it because it becomes there's a lot of itchiness. To control itching, it is very important that you start having good amount of water intake. Plus, use good amount of water-based moisturizers or cream-based moisturizers. If your skin is very dry, Sonam, then I would suggest that you use good amount of cream-based moisturizers. This will help you in your early healing of dryness. Varsha is asking that can I help her with certain stretch marks cream? There are a number of stretch mark creams present in the market, but go for stretch mark creams which have good amount of cocoa butter or shea butter, something which also has a supplement of vitamin E in it. Nowadays, there are many stretch mark creams available with the elastin and collagen fiber supplements or elements into it. So I would suggest that when you're going for a stretch mark cream, you see you have these following things. First one, it should have a good amount of vitamin E. Second, cocoa butter or shea butter. Third, it should also have elastin and collagen supplements into it, collagen fibers or natural collagens. So when you have all these things listed in a stretch mark cream, it will help you with the early healing or reducing the damage that is caused by stretch marks. Apply the cream at least 2 to 3 times in a day. It takes a while for the stretch marks to go, but if you use it regularly, you will definitely see a good result in it. So I would suggest a stretch mark cream with all these three things into it. Varshna wants to know that how often can she use the cream? She is 9 weeks pregnant. You can use the cream 2 to 3 times in a day. There's no harm in that. Use the cream 2 to 3 times in a day. When you're applying the cream, massage it for at least 2 to 3 minutes so that it gets very easily absorbed into your skin and the efficacy of the cream improves. Along with the cream, you can also use certain oils if you want, oils which are enriched with vitamin E. Even these oils will help you with your stretch marks. The stretch marks won't go off completely, but they don't really get darker compared to how it would if you don't use the cream or oil. Along with stretch marks, use good amount of moisturizer as well. Try not to keep the areas where you have stretch marks dry, because if you keep them dry, you see that the stretch marks get more darker and they get more whiter and lighter in shade. So try keeping the area soft and smooth. दुर्गा जी पूछ रहे हैं कि what vitamins are good for hair loss after pregnancy. A number of vitamins. You can actually have multivitamins which has the list of vitamin E, vitamin C, vitamin B3, vitamin B12. It also has iron into it, folic acid into it, trace elements. When I say the trace elements are also very important during pregnancy, you see the amount of the trace elements are very less. The consumption of a multivitamin is important because it has all the elements into it, all the vitamins, all the minerals in the right proportion, which will help you in compensating for the loss that you had during pregnancy. So vitamins, again, I would suggest what it should have is basically vitamin E, vitamin C, vitamin B3, vitamin B12. Calcium is also important into it. The trace elements like magnesium, potassium, even that is important. Other things that are important is also zinc, then your iron levels, your folic acid levels. So all these vitamins and minerals are good for your hair loss. Biotin. Biotin is also very important. Biotin is something what we associate a lot with your hair fall or hair growth. So a supplement which has all these things are good and healthy, not only after pregnancy but even during pregnancy, which will help in reducing hair loss. Plus, it will prevent hair loss. We also have a number of people or number of patients जो आके पूछते हैं कि डॉक्टर सनस्क्रीन बहुत सारे हैं मार्केट में, हम कौन सा सनस्क्रीन लें, हमें कैसे पता चलेगा कि कौन सा सनस्क्रीन ज़रूरी है, कौन सा सनस्क्रीन ज़रूरी नहीं है. तो जब प्रेगनेंसी के टाइम पे बहुत सारी चीज़ें होती है, बहुत सारे केमिकल्स ऐसे होते हैं जो हम अवॉइड करना चाहते हैं. तो ड्यूरिंग प्रेगनेंसी आई वुड सजेस्ट कि आप ऐसी सनस्क्रीन्स लीजिए जिसमें mineral based sunscreens में zinc oxide हो. Try not to go for sunscreens with heavy chemicals or certain heavy sunscreens जो काफ़ी ऑल्ट्रेशंस करते हैं हार्मोनल लेवल्स में भी. तो ये ज़रूरी है कि आप सनस्क्रीन्स वो लें जो SPF 15 से लेकर SPF 30 तक हो. अगर आपका स्किन जो है ऑयली है, सो यू कैन गो फॉर सनस्क्रीन विच इज़ वाटर बेस्ड. इफ योर स्किन इज़ वेरी ड्राई, यू कैन गो फॉर सनस्क्रीन्स विच आर क्रीम बेस्ड. So depending upon how your sunscreen, how your skin tone is very important. Also try avoiding sunscreens which have the content or something called as oxybenzone. The reason why I say try avoiding oxybenzone is because it is a very high chemical which sometimes alters the estrogen levels in your body. And during pregnancy, the estrogen levels are very important. At times, it causes a chemical disruption. तो अगर ये chemical disruption हमको avoid करना है, so try avoiding this content in your sunscreen. Go for sunscreens which mainly have zinc oxide or the mineral-based sunscreens from SPF 15 to SPF 30. A lot of females come up with questions that if can she go for chemical treatments of hair during pregnancy. There's nothing which shows ऐसी कोई study तो नहीं है जो बोलती है कि आप नहीं करें, but there are certain chemicals which are used which we don't know कि वो आपके ऊपर और आपके बेबी के ऊपर किस तरह से अफेक्ट हो सकता है. तो जितना आप केमिकल ट्रीटमेंट्स ड्यूरिंग प्रेगनेंसी अवॉइड कर सकते हैं दैट इज़ बेटर. ट्राई नॉट टू गो फॉर ट्रीटमेंट्स विच इन्वॉल्व केराटिन या फिर सिस्टीन या फिर जो वो केमिकल्स जो फॉर्माल्डिहाइड यूज़ किए जाते हैं. फॉर्माल्डिहाइड इज़ अ वेरी स्ट्रॉन्ग केमिकल जो हम सब जानते हैं कि वो बहुत ज़्यादा स्ट्रॉन्ग होता है, कार्सिनोजेनिक होता है, हार्मफुल होता है. तो ट्राई अवॉइडिंग सर्टन ट्रीटमेंट्स जिसमें फॉर्माल्डिहाइड यूज़ होता है. अगर ग्रेइंग ऑफ हेयर आप देखते हो तो सिंथेटिक कलर्स या फिर केमिकल्स से ज़्यादा यू कैन यूज़ henna पाउडर और यू कैन यूज़ नेचुरल डाइज दैट कैन बी helpful for you. So avoid chemicals or avoid certain harsh products which might cause certain changes on your body or on the fetus which we don't really want to. So this is what I would tell a number of patients to look after when you are looking into your hair also. एक पेशेंट पूछ रहा है कि उनको जो है मॉर्निंग सिकनेस होता है जिसकी वजह से इट्स वेरी डिफिकल्ट फॉर हर टू यूज सर्टन शैम्पूज. बहुत सारे शैम्पूज जो हम यूज़ करते हैं हमारी नॉर्मल डे टू डे लाइफ में it has a lot of fragrance into it. So you will actually ask your gynac or your dermat to give you certain shampoos or conditioners जिसमें फ्रेग्रेंस नहीं है, नो फ्रेग्रेंस वाले आप यूज़ कर सकते हैं. दैट वुड बी बेटर फॉर यू. तो यस, ऑल्सो द मेन थिंग व्हाट आई वुड सजेस्ट इज बहुत सारी चीज़ें आप मार्केट में देखोगे, ऑनलाइन देखोगे, you get tempted to get all these things. But when you see certain products, as a doctor, I recommend and I suggest and I actually ask my fellow people, my patients, that clear all your doubts. If you want to buy certain products or use certain products, please talk to your dermat, your doctor, your gynac to see how the product is efficacious, how good it is, how genuine it is. Get it approved by your doctor and then use it, because pregnancy is a time when you want to take the utmost care of yourself and the baby that would be coming. So it's always better to prevent rather than curing things. So this was all for today. I'm really happy that I could be of use help for a number of people who had certain questions. आई होप मैंने वो क्वेश्चंस ठीक से आंसर किए हो और आपकी क्वेरीज जो है वो काफ़ी सॉल्व हो चुकी हो अभी तक. And that's all for today. It was really nice being on this platform, helping you all. It always makes me feel good when I connect with so many people live. Also, I would say that please follow me on BabyChakra. You can use my referral code and my name Sofia, Sofia. You can get certain offers and discounts. So please follow me on BabyChakra and love to be here. Thanks a lot. Have a good day to everybody.